Hello, welcome to another episode in the Veterans Helping Veterans TV series. My name is Cheryl Schaefer, and we're filming this episode in March. And March happens to be Brain Injury Awareness Month. And today's show is, what is TBI? We're very fortunate to have from the VA in Palo Alto, neuropsychologist Maya Yutsis. Doctor, can you tell me a little bit about your background and why you chose this career field?
Absolutely. Hi, Cheryl. And first of all, I wanted to say thank you for inviting me and thank you for having me on this show. It truly is an honor to speak on behalf of many other healthcare providers who work with veterans and service members who had a brain injury. And so I think it's great that we're able to get this message out there during this month. I am currently a neuropsychologist at the VA Palo Alto Polytrauma Transitional Rehabilitation Program, and we're part of the larger Polytrauma system that includes both inpatient rehabilitation unit and the outpatient network side, and we specialize in working with veterans with traumatic brain injuries, or TBIs, who also have sustained multiple other injuries to other body systems and who have many other psychological health issues and health needs. And as you asked me what got me into this field, and you can probably hear that I am not from around here originally. I am from Republic of Georgia, and I immigrated to this country when I was 14 years old. But prior to that, when I was 13, I was walking home with my friend, and I was about 2 doorways away from my house where a neighbor of ours who was standing at the bus station got shot. And at the time, I didn't know that he died, but I remember my initial reaction of wanting to run towards him and help him, which I did. And I ended up calling the 911, and then I started to scan my environment around just to try to figure out where the gunshots were coming from. And what I saw that my friend was standing there, still frozen, unable to move. And when the...
So she had a completely different reaction than what you had. She was frozen in fear.
Exactly. And we always talk about that flight or fight response. Mm-hmm. And, you know, I was definitely in that flight or fight, but she was in the freeze response mode where she couldn't move. And, you know, it took us a few days, if not a few weeks, to truly process what happened. But ultimately, the question that I walked away with is, how interesting is it that different people react completely differently to what seems to be a similar traumatic event? And why is that? What makes everyone react differently? And that's how I first became interested in psychology. But growing up in Russia, not a lot was available in terms of mental health issues, mental health resources. Nobody really talked about those issues.
In that country, do they even know what PTSD is? Do they acknowledge that as an illness, or they just
I don't
bypass
think
it?
No, there is no name for that diagnosis. We had quite a few veterans coming back from Afghanistan, and what happened is that they were socially shunned. They lived in areas that no one else lived in. They usually were using substances quite heavily, and I think that culture just wouldn't accept mental health issues, and it was a taboo thing to talk about, certainly. And it's still true at this time.
And that's really sad
Mm-hmm.
when you compare that culture to this culture. And, you know, we talked about this before the show. A lot of these people that suffer traumatic brain injury and polytrauma, they're surviving injuries that before this war, those were casualties.
Absolutely.
So now it's a completely different needs that these people have that the VA has not had before. So I know you can't cure everything. And it really is a matter of teaching veterans coping skills. Well, how do you do that when you have polytrauma and when part of that is a traumatic brain injury? How do you do that, doctor?
Very slowly and carefully. But I think you hit the nail on the head that the word polytrauma itself implies that there are multiple injuries. It's not just the brain injury. It also includes limb loss. It includes burns, fractures, loss of vision, loss of hearing. These are pretty complex injuries, and because of the advancement in military medicine, as you said, a lot of people are surviving these life-threatening issues, which is a good thing. But on the other hand, it's also one of the challenges that we're facing, that people are surviving with lifelong deficits that they need to learn to compensate for. And while we're getting better at educating our service members as well as veterans and their families about services available in our system and about TBI and what are the common symptoms and what can you expect short-term as well as long-term, still not many people know about it.
Well, what are those?
So, you know, as you can probably see the little friend that I brought here.
Yes.
And what I wanted to say is TBI really is a result of a jolt or a blow to the head, which alters normal brain function. And sometimes it's a penetrating brain injury when an object such as a bullet fragment directly penetrates the skull, which is this guy. Oh. And it directly affects the brain tissue itself. That's a penetrating brain injury. But most commonly, it's a closed head injury, which happens after blast explosions, which is the hallmark injury of OEF war. And essentially what happens is that there's a high pressure wave that impacts the brain in a way that it starts to oscillate inside the skull. And the brain is surrounded by liquid, which for the purposes of us who are not super coordinated, we don't have liquid. But I wanted to show you something, that the skull itself is not smooth, not at all. And in fact, if you look here, it has these bony, sharp edges. And so when the brain oscillates, it hits different sides of the skull, and most commonly it's this side, and you can see that there's this sharp edge inside of the occipital lobe. And then it hits the opposite side of the brain, opposite of the direct impact side. And again, there are pretty sharp edges here. And so these are the most common sites of injury: occipital lobes, frontal lobes, and temporal lobes. And these are lobes that are responsible for our ability to learn and remember information, for our ability to focus and attend, for our ability to process information pretty quickly. So pretty vital functions, as you can imagine. And we have young veterans or young service members coming back, and of course, going back to work and going back to school are key for them. And when their ability to remember new things or process information has been affected, you can see how it can have pretty life-altering effects. But I did want to say that not all TBIs are the same in terms of severity.
Right, because part of what's happening here is the brain is actually being bruised.
Exactly. And that's the first. And being just bruised without any other injuries is a sign of a mild brain injury, which is the most common form of brain injury. And in fact, about 80% of both civilians and service members suffer mild brain injury. The good news about that is that within 7 to 10 days after brain injury or after mild brain injury, we do expect full recovery, and about 80 to 90% recover fully within such a short period of time. From several weeks to 3 months, we again expect full recovery for at least 85% of people who had mild brain injury, which is really good news.
Well, that's because this is like a plastic. So it has the ability to, I'm not sure of the right word, to adapt itself.
Brain is definitely very plastic. It regrows, or neurons or neuronal connections regrow, especially within the first several weeks to several months, up to 6 months for moderate to severe brain injury. Brain continues to regrow and heal itself. Unlike in mild brain injury, after moderate to severe brain injury, we're not sure about how much a full recovery someone can make. But certainly, every individual's recovery journey is different. And so it's really key for someone who had mild head injury or moderate to severe brain injury to seek help as fast as they can, to get diagnosed, to make sure that we know what happened, and to start addressing certain deficits that can stem from this injury.
Especially for this youngest generation of veterans who no one wants to admit that they got hurt. No one wants to admit that they have a weakness. But I'm making the assumption that if you're in a tank and you happen to hit a roadside bomb and you're inside that tank and you're bouncing around inside that tank, you have to have something is happening to you, even though there may not be physical damage that someone can see. And that's the point of the show, is to let people know that you may not see it. It's an invisible wound.
Absolutely. And I think you pointed out quite accurately that we don't see our brain. This is not a cut on your hand that when you get a cut, you see it and you know that it's healing. We don't see what's happened to our brain. And as you pointed out, just traveling at a high speed and getting hit can result in brain injury. It doesn't have to be an open wound. It doesn't have to be a penetrating injury. And not all brain injuries, and especially not mild brain injuries, result in loss of consciousness. You may simply feel disoriented or dizzy at the time of injury. So those are definitely also symptoms of mild brain injury and concussion. Having said that, not all jolts or blows to the head result in brain injury. So you really have to be careful in educating yourself about what are the symptoms of a concussion or a mild brain injury, which can include simple things, just as feeling dizzy or disoriented, or how a lot of veterans describe it, I saw stars, which can last a few minutes and it can last a few hours or even days. Feeling nauseous, having a headache, having difficulty balancing, having really high sensitivity to bright lights or loud noises, or seeing double. Those are all physical symptoms that something has happened that altered your brain function. Cognitively, you may notice that you're just a bit slower to process information, that you may be hearing the beginning of the sentence, but then you lose the end of the sentence. You can have trouble focusing or paying attention. You can have trouble carrying on conversation just because you lose track of your thoughts. You can have problems with learning new information or remembering it.
Well, since so many veterans are coming back from this latest war, they know they're not job ready. And a lot of them are enrolling in colleges on the GI Bill, which, you know, they have the best GI Bill, so why not take advantage of it? Now, I know that many schools are trying to adapt to the needs of the veterans that have TBI. So can you tell us a little bit about the back to school?
Absolutely. And as you probably have in front of you, we have the Defense Veterans Brain Injury Center that was initially established in 1992. And its primary goal is to optimize care for the veterans, not only by offering state-of-the-art clinical care or research, but also disseminating education to service members, veterans, and their family members. And as part of that, the most recent published work by that center is the Return or Back to School Guide. It's this wonderful pamphlet, and you can see it's pretty thick. They've included essentially all questions that one can ask when you're thinking about going back to school. How do I apply for financial aid? Will my GI Bill cover my classes even if I'm only taking one class?
Well, that's a great question. Will they?
It will.
Okay,
and
very
that's
good.
key for our veterans with brain injury, because what we're teaching them is that you should slowly integrate back to the regular classroom or back to work, because you need to pace yourself. It's not a sprint.
Right, and because that's what a lot of veterans discover. They think, oh, college, okay, I can take 3, 4, 5 courses of full load, and then they're overwhelmed.
And then they fail out.
Yes.
They're overwhelmed, and they had such a horrible experience that they don't want to repeat it.
Right, exactly right.
And so this is truly a guide to teach them about the resources available. A lot of colleges are now incorporating centers for people with learning disabilities or any type of disability, and specifically traumatic brain injury. And if you had a traumatic brain injury, even mild traumatic brain injury, you may qualify for accommodations at the college, such as extended period of time for exams, which is key, separate room for taking exams so there are not too many demands on your attention.
Or too many distractions.
Exactly.
Yeah.
Having a note taker is a possibility. Some teachers are able to provide you with handouts or additional kind of homework assignments in a different format rather than just the lecture format, and so you can learn that information at your own pace at home. Some teachers do not like when the lectures are recorded, but if you have accommodations set up, you can record the lectures and listen to them. You can also bring in different tech tools, and actually this guide has a section on different new technology gadgets, such as a reader pen that you will just slide over the text and it will verbalize what you're reading. So if you have vision issues or if you can't focus for too long, it will read for you, which is a great tool. So truly, this is an excellent guide, and they also show you examples of how to create your schedule, how to create a very organized schedule of when you're doing homework, when you're doing other day activities. And also they talk about different problems, such as attention problems or memory problems, and how you can compensate for them.
Because really, basically, the way I understand it is there's not necessarily a cure. But really what the VA is doing is teaching coping skills, teaching the veterans how to adapt to their injury.
Absolutely.
And let's see, you said the phrase earlier, optimize. Optimize what you have. So if there is no cure, but you teach coping techniques, how do you outreach to the families and friends of this, of the TBI vets who say, well, he looks okay to me. How many times have you heard that? He looks okay to me.
Right. But something is not quite the same.
Exactly.
I think VA in recent years has recognized that the injury is not just happening to the person, it's happening to everyone around that person. And as you said, you know, for mild head injury, I do want to say that we do expect full recovery, but for more severe forms of injury, there may not be cure and some deficits may never go away, but everyone has strengths. So the way how we work with veterans and service members is that we conduct pretty comprehensive assessments and say, well, your learning style is a visual learning style, for example. You learn much better if I show you a diagram or write it down for you. So we start to focus on the strengths that each veteran has or each service member has, and try to teach them to use new strategies to accomplish the same things that they used to accomplish before the injury. We also reach out to families and caregivers. Again, DIVBIC, another acronym that is so favored in the military. DIVBIC also has wonderful pamphlets for family members.
Can you tell us what that means, Doctor?
It's a Defense Veterans Brain Injury Center.
Thank you.
I think I have it right. I hope so. So they've made a lot of pamphlets for family members for how to explain TBI to children, especially for our younger service members who have younger children. We have a family counselor available across all polytrauma units who works specifically with family members, alone or together with the patient who was injured. So we're starting to recognize the needs of families and we're trying to address them.
It takes a village.
Absolutely. It's a large village.
Yes, ma'am.
Sort of a city.
Yes, yes. Describe your techniques of teaching patients these coping skills. And when I went onto your website to do a little bit of research, I discovered the memory book.
Yes.
Very simple, but really a powerful tool.
Absolutely. You know, there are many different techniques, and every veteran is very much different in terms of what their strengths are and what the deficits, but memory book is a great way to compensate for some memory issues. And I think we all have them. There are days when we all say, what was it that I was supposed to do? And you just can't remember. And so now we've shifted a little bit from the memory book and put it into the electronic format, because everyone now has these wonderful smartphones and tablets and all these gadgets that are so common in our culture that for someone with brain injury to use them, it is not looked down upon, because the problem with memory books was that people were reluctant to pull them out in public. They were reluctant to use them. But a phone is such a common thing that nobody will even pay attention. And you know, a simplest calendar on our smartphone can serve as a teaching technique. For example, so what happens with memory books is we teach the patient, okay, so today you will be scheduling an appointment for 3 o'clock with so-and-so. Tell me, where would you put that in your calendar? So you teach them how to look up the exact time, how to look up the exact day, input the appointment in a way that when they look at it, it quickly conveys the message. I have an appointment with this person at this room at this time. You also teach them to set up alarms or reminders, maybe an hour before the appointment, maybe 15 minutes before the appointment. On our unit, patients live on our unit. So it takes them about 5 minutes to go from office to office. So their reminders are set at 5 minutes before the appointment to make sure that they're on time. And so everyone just requires different level of reminders or different types of cues. And so we work on that. For some people, just an alarm doesn't work because of the hearing issues. So we're able to encode pictures or images of someone's door or someone's face that pops up as a reminder for them.
How many patients do you have over there at the Polytrauma Transitional Rehabilitation Program?
That's a complicated question. So on the inpatient rehab unit where patients come in immediately or within 1 week after injury or after stroke, we have 18 beds right now, and we're growing, so we will have 24 beds on that unit. On the Polytrauma Transitional Rehab unit where I work, we have 10 beds right now, and we're growing to 12 beds. And then the Polytrauma Outpatient Network side is as many as you can, and I know that they see approximately 300 to 400 veterans every year. So they're a large service. But for us, because our patients reside on that unit for quite a significant period of time, just because brain injury recovery is a long period of time, we want to make sure that we're addressing everyone's needs rather than...
Is there a limit to how long they can stay there? Is there like a minimum 6 months and then they have to find a nursing home or an outsource resource in the community?
You know, I don't think there is a limit. It is very much goal driven. For us, the stay can be anywhere from 1 month to 6 to 9 months. It just depends on whether the patient is progressing and they have goals to work on. If it's a return to work, we will specifically work on those goals, and that takes a lot of skill. So often we set up patients to volunteer at the VA services so they can get back to that work environment and try their hands in it so they're ready at discharge to go back to work.
Let's talk a little bit about your most severe patient that you've worked with, most severely traumatized, polytrauma. Because we were talking about this a little bit before the show started. You told me this wonderful story about a patient there.
Yeah. You know, he was truly an example of someone who I learned the most from and I was most impressed by. This is not to say that I don't learn from every patient that I work with, but I think his injuries were so severe that if you just looked at his medical chart, you would say the prognosis is very poor. But this was a person who was in his 20s and who suffered a gunshot wound, which went through his entire left hemisphere. And if you know anything about the brain, you know that left hemisphere is what governs how we speak, how we reason, how we learn and remember information verbally. So this is quite an important hemisphere to have. It also governs right side of the body. So what happened to him that in addition to brain injury and cognitive changes, he couldn't speak, he couldn't write, he couldn't move his right hand, he couldn't walk. And he was also wearing a helmet throughout the rehab because part of his skull was missing to make sure that the brain wasn't swelling. And so when he came to our unit, this was a person who couldn't speak, who couldn't write, so he couldn't express himself at all. But what happened, remarkably, that after we completed all of our assessments, we realized that his right hemisphere was completely intact. And not only was it intact, but his visual spatial skills, his ability to read maps, his ability to remember information that he saw, his ability to make sense of the most complex visual patterns was excellent. he was in the 99th percentile compared to all general population. I wish we were also lucky to be in that percentile. But what happened is that this was someone with pretty significant deficits. And what he chose to do consciously is not focus on those deficits, because the likelihood of those deficits resolving was very poor. And he focused on his strengths. So he started to use his left hand for writing. He started to use his visual skills for doing everything, and learned 2 programming languages while he was on rehab.
That's pretty impressive. 2 programming languages?
Right.
Wow. So it really is a matter of the patient learning to adapt to his injury
Right.
in order to recover as much as they
Exactly.
physically can.
Exactly.
Do you have any closing comments that you would like to make to a veteran who may be sitting out there that may not realize he has this injury?
Yes. Please seek help. Please ask for help. There is help, and we're trying very hard to provide services to everyone who served this country and who deserves this help. And just because you had an injury, it doesn't mean that you cannot do things that you want to do or live a meaningful life. There is help, there are resources. Please seek that help and reach out.
Thank you for watching Veterans Helping Veterans TV. We are Veterans Helping Veterans. We encourage you to join any veteran service organization, AMVETS, American Legion, Disabled American Veterans, Veterans of Foreign Wars. It's through the involvement in these groups that we have the benefits that we have as veterans. Seek help. We want to help you. So, VA Palo Alto phone number, someone would like to contact you?
650-493-5000.
Very good. Get the help.
Get the help.
You earned it.
Absolutely. Absolutely. We're here.